One of the great things I think about my job and being in academic neurology is that there really is no typical day. I do both neurohospitalist, so inpatient neurology, and when I'm on service, I will go around with the teams. And one of the favorite things I love to do is to educate our students and residents and trainees. And so I round with them typically in the morning or in the afternoon. And then I'll go do my research, which is in my subspecialty, which is neurological infectious diseases. And so I'll work on projects, I'll meet with my mentees, I'll go see patients that we're recruiting for different studies. And then I'll usually check in if I'm on service towards the end of the day and meet with the team. So I get to interact with a lot of different people all day long, which is a lot of fun for me. I think one of the great things about being in academic neurology as well, for me, is that there's a great amount of flexibility in terms of what I both do at work, but also the flexibility so that I can do the things that I enjoy outside of work as well. So I have two young children, and I'm able to really support, their lives early on, and be around for them when they are growing and learning as well. And also hopefully serve as a role model. So, I get to go to school and talk about the brain and doing different activities. So in my role, both as like a neurohospitalist, when I'm on service, it's busy, but when I'm off service, I have a lot of flexibility to kind of do the things I like to do and do my research and also be there for my family, which is something I really care about. I also work abroad, so I'm able to take chunks of time and do my research abroad and see patients and work collaboratively with people all over the world, which also I think is really just an incredibly unique part of my career. What inspired me were the people that I was around early on in my career. So some of the folks that mentored me in academic neurology, who were really incredible educators, leaders in the field, who really foundationally loved what they were doing every day. And I think that really inspired me to do what I do. And I'm in a pretty small subspecialty of neurological infectious diseases. I do also inpatient work, and I do work around the world. So I get to interact with a huge amount of people, which I really love, and it really always challenges me. I think I'm always excited by my day and the new things that I'll see either in patient care or in research or when I teach folks who ask me questions and educate me as well. So I think that's really what's so exciting about academic neurology is that there's always something new. Over time, there's been a lot of changes and new aspects to my career, which has been, I think, really exciting. And one of the really exciting things about being in academic medicine in general, which is that you can kind of continue to evolve yourself. Um, when I was training, I really thought I would be doing clinical practice nearly full time, and always loved education. But then when I became a fellow and early on in my attending years, I really loved research, doing clinical research, asking questions that would really impact our patients, and then also kind of around public health policy. And so I've integrated that into my career. More recently, as kind of research questions have evolved in neurological infectious diseases, I'm working more and more in the implementation science space. And so working with a lot of folks that are School of Public Health and around the country and world, really trying to understand how we can move science to the bedside, which has really been an exciting frontier to be involved in. And there's always evolving changes that I think are really fun and exciting. I think my role in being involved in the American Academy of Neurology has really I think brightened my career and introduced me to a lot of wonderful people. And so I'm part of a number of committees, which I think has really been so fulfilling, and really interested in kind of moving that agenda forward as well. I think there's a lot of things, honestly, that are really rewarding. I think to me, I think one being around trainees who are learning and growing in the field, and then seeing those trainees at the AAN annual meeting and seeing how they're flourishing in their careers is probably one of the great joys that I have. I think taking care of some of the most complex patients and our responsibility to kind of move the needle forward in the field in terms of the bedside clinical care is also really rewarding. And then I think our ability to ask questions and then evaluate and study those questions that are important to our patients is really exciting, and a part of my career that I think I've really found a lot of joy in. I think the advice I would give is to really follow where your heart is. I think that one of the great things about being in academia is that you don't really have to follow a straight path, that you can kind of define your own career. And I've been lucky to be able to do that. And I always tell my mentees that you need to really love the things that you do, not feel like you have to do them every day. They shouldn't really feel like work if you're doing the right thing. And there are bumps along the way, but I think it's about kind of following where your heart is and trying to make a career out of that. And I think we also need to support people to kind of be innovative and creative in their careers. So being in a place and being around people in academic medicine that really are invested in you and what you want to do, and the uniqueness of you and your career, I think is really valuable. And I think some of the great benefits that exist is that you don't have to be one type of person. You can really define yourself and define yourself differently as your career evolves.